My name is Janine. I am a sonographer here at AMI, or Atlantic Medical Imaging. So advice that I would give to anyone new coming into our field, or somebody who is wanting to be a sonographer, do it. It's not easy. It's gonna be a lot of blood, sweat, and tears along the way, but it's a respected field. I mean, think about it. We are the one true modality that is 100% dependent on that tech to find what's wrong, notify the doctor, get the best pictures that you can, and make the best diagnosis for that patient. It's not always easy. In fact, often it's very hard, but at the end of the day, you can walk away and be like, I did this, so do it. So I started off my career. I went to college for diagnostic medical sonography. The program that I went to was an accelerated program, so it went straight through. There was no summer breaks. There was, right to the grind. But it was good. It was an aggressive training, but it was something that kind of prepared you for the field that you were going to be in. The training that I had was not just clinical, but a lot of book work. The education was going to clinical sites, learning hands-on with every patient. Each study, from abdomens to vascular studies, breast imaging. So there were a lot of different ways and things to learn. When I teach and I train, you really kind of go back to your basics, to the things that you learned in school, even 23 years later. How do you measure it? How do you take this picture? Well, these board questions are very similar to the board questions that I took 20-something years ago. So stick to your basics, explore your things that are out there, give yourself as much information as you can from other people. Take any kind of knowledge or tips and tricks that people want to give you. Hey, try hitting this button, or did you try, turning the patient? Did you try doing this? How about you increase your depth? How about you try this different probe? Sometimes thinking out the box is what makes you a better sonographer, because why would I just do all these cookie cutter things that, I have to use this probe, or I need to do this with this patient? No, you don't. Ultrasound is all about getting the information that the doctor's looking for. And sometimes it's not the way that you traditionally think that you would. So think outside the box. Change your probes, turn your patient, do something different. You'd be surprised how many things would kind of pop into the image or get that quality picture that you were looking for just by doing something different and outside the box. If you're interested in doing ultrasound, this is my journey. Everything that we do is important. Everything that we can do to help get the answers, to get the diagnosis for our patients. Every one of those things can lead to saving a life. And as far as I'm concerned, that's everything. Thank you for listening. For more information, go on AMINJ.com.